Hello people, in this video let's look at this topic, anti-Mullerian hormone. So something here is anti that is against the Mullerian, right? So anti-Mullerian hormone, okay? So it is against this Mullerian, okay? So anti-Mullerian hormone, why are we reading it? Because my friend he brought his wife's report and said her AMH levels, and one of the things in the report was this. What had they gone to the doctor for? They had gone to the doctor because they have infertility and her cycles were 60 days long, so she had oligomenorrhea, very few frequency of period, right? So basically, in her, when I saw the report, her AMH levels were between this 4 and 6.8. So she had optimal fertility, which is a very good thing, right? Optimal fertility. So as soon as they read that, they feel very happy. Why? Because they are going for treatment of infertility. So just note here, what is this AMH? So AMH is anti-Mullerian hormone. You can see the two dots on this U. This is very difficult to search because of these two dots. Everywhere these two dots will be there. It's like as if the two ovaries are making the AMH. No, that's why they put the two dots. So who is making the AMH? I will tell you, the follicles within this ovary. The follicles inside this ovary are making the AMH. AMH is being made by these follicles. AMH. So what will AMH indicate? The number of follicles which are there inside the ovaries. Okay, it won't say which left and right, that and all you won't know, but at least you will know how many follicles are there. So let us read this. Anti-Mullerian hormone is a peptide secreted by the granulosa cells of the primordial follicles. We'll just remember that it's secreted by the follicles. Okay. And what does this AMH reflect? It's reflecting the number of growing follicles in the ovary. Number is the word here. Number. It indicates what? The number of the growing follicles in the ovary. So now in case they want to induce, they want to make sure this, they're going to give her some drugs so that she ovulates, right? So they want to know whether she will respond to this ovarian stimulation protocol. Will she respond to this? So that is what they're trying to find out. Okay, so they're using it to know the ovarian reserve. How many ovaries, not ovaries, how many follicles are there, and will she respond if we give her drugs like clomiphene, citrate, etc. Will she ovulate? Okay, you got it right. So that is why they are checking this. So now you tell me, if this is low, if it is low, if like this, if it is low, what does it mean? You can check FSH levels. Probably FSH levels will be very high, okay, that it is trying to stimulate, okay. Or it can also mean that she is very close to menopause, right? That is why the number of follicles are low, okay, number of growing follicles are more. Now what if it is high? High can be sometimes bad also, okay. High can mean that it is a PCOS, some tumor, cancer also it can mean, okay. So high can be an indicator, it could be a marker, tumor marker, okay. Now the AMH story is actually more, okay, there's more to it. Think that this is a uterus and inside this there's a fetus, okay. Now this fetus has to grow male genitalia, okay, or it has to grow female genitalia, correct? Oh, what is there in that? Based on X and Y, it will grow, correct? No, but it needs hormones, okay? So this AMH is actually in the male fetus. It will make sure that the anti-Mullerian part works, okay? The anti-Mullerian this male baby needs. Then only it can grow the male genitalia, okay? So it needs anti-Mullerian to suppress the female genitalia from developing. So that's why AMH I'm writing in blue. Look at this statement here. The female genital tract develops from the Mullerian ducts. Okay, so let's make this pink for you. The female genital tract develops from the Mullerian ducts. So the boy needs anti-Mullerian hormone. Okay, so the female genital tract develops from the Mullerian ducts. Mullerian ducts will give what? Female genital tract. Now this, if it should not happen, that is in a male child, what does he need? Anti-Mullerian hormone, so that he does not develop female genital tracts from this Mullerian duct. Understood, no? So AMH plays key role in developing a baby's sex organ while in the womb. AMH levels are higher in male babies. That's why I have highlighted this in blue. Whom is it higher in? It is higher in male babies, as this prevents them from developing female reproductive organs. Okay. So from the Mullerian duct system, the female genital tract. See, it's not the reproductive system. They're talking about the genital tract. Okay, the external genitalia kind of a thing you can remember. Okay. Look at this here. Male on the side. They've shown male. Male needs AMH and he needs testosterone, etc. to develop what? External male genitalia. Okay. And what does female need? Absence of AMH, absence of testosterone to develop female external genitalia. So male needs AMH. Okay, that much have you understood? Very good, people, very good. Now look at one more diagram here. Male has what? Anti-Mullerian hormone. It is secreted by the Sertoli cells. That means it's not just the ovaries that secrete AMH. The male testis also makes what? The AMH. And the AMH actually is very important for the male fetus. You got it right? What else I want to say here? That's all. So male testis, that is the Sertoli cells, makes what? AMH. Male testis Sertoli cells makes AMH. And in female, the granulosa cells make the AMH. Okay. In fetus, the male baby will have more AMH. Okay. Now look at this. This person looks like a female. Why? I'll tell you. This person is actually XY. That is a male. This person has male reproductive organs inside. But this person has female genitalia. External genitalia looks like female. Has breasts. And looks feminine. Why? So basically, look at this condition here. This is an androgen insensitivity syndrome, testicular feminization. This person looks like female. Okay, so this person will have a vagina which is short and blind, but they will not have uterus or tubes. Why? Because they don't have female reproductive organs. They have male reproductive organs inside actually. Okay. Why all this happens is because of less anti-Mullerian hormone. So what happened in the baby itself when born? The Mullerian duct will give the female genitalia because there was no AMH. Because there was no AMH to stop this guy. So no anti-Mullerian effect was there. So the Mullerian duct gave the female genitalia. Then this person also has testosterone insensitivity. So this person developed breasts. Because of testosterone insensitivity, the person also has a lot of feminine features. Okay. At puberty, the conversion of testosterone to estrogen stimulates breast growth. Okay. So this person has a vagina, but does not have female reproductive organs. Okay. No spermatogenesis also in this person. No spermatogenesis, not making sperms. Okay. Now, many people will have doubt. So what will be the level of AMH if I check in a male? Because whatever we spoke initially was female adult optimal fertility and all. What happens in male? If I do the same AMH serum AMH blood test, if I do in a male, what answer will I get? Okay, male infant will have more, that you know. Okay, male infant will have more AMH than a female infant. Boys will have more than a girl. Okay, then once testosterone starts getting produced in male puberty, the AMH level rapidly decline. Okay, so the male which was more till puberty, the levels after that it actually starts declining, and then it will be similar to healthy female. Look at this diagram here to understand. Male is more, I will use a blue here. Male is more always till puberty, right? So 12 years puberty, right? So after puberty the male starts declining. He will become almost similar to female, the levels, right? And then very slowly he declines after this. But the female level of AMH declines after 35 to 55, it is declining, and around 55 it is actually showing very low levels, menopause, right? Because it is an indicator of onset of menopause. So did you understand? Now let's get back to the topic on hand. What was the topic? The person who brought his wife's report, correct? So we have to treat her infertility. So let us understand only from her perspective now. Is AMH the only way of knowing that she has diminished ovarian reserve or not? No. What is her ovarian reserve? That we can find out by many ways. Okay, so you can check what and all. Let's look at that now. You can check FSH levels. You can check estradiol, that is estrogen levels. You can do a clomiphene citrate challenge test. Okay, to know whether she's having good ovarian reserve. Okay, then you can check serum anti-Mullerian hormone, which they have done for her. You can check inhibin levels. Okay, but this is not reliable, it's written. Then you can do a transvaginal ultrasound to check the antral follicle count of the ovaries. Transvaginal. So they will put a condom on the ultrasound probe, which is like this. They'll put a condom on this probe to protect from infection, and they will insert it into the vagina, usually on the second day onwards, right? So that is why you should go clearly for your appointment. So transvaginal ultrasonography to check the number of primordial follicles, okay? And then they will check the volume measurement of the follicles, okay? Volume. Fine? Not the number. Here they're talking about the volume. So did you understand? There are many ways of checking the ovarian reserve. So how can you compare AMH and ultrasound, which we told you, the transvaginal ultrasound, to detect the ovarian reserve? So with ultrasound, what they are saying is not just this ovarian reserve. You can know if there are any anatomical problems. You can know if there are some other pathologies like fibroids, endometriosis, PCOS, tubo-ovarian mass, any mass present there. That also you can check. That's what they are saying. When do you do this AFC, that is the antral follicle count? You do it on the day 1 of the cycle to day 4, but this lady was called on the day 2 to come on day 2, okay, of the cycle. Okay, next. How many follicles should be there? They are saying normal is 10 to 20. They didn't say per ovary or both. I think both together they should be 10 to 20. So this I think is a basket showing both the ovaries together. But in each there should be 10. Okay, that will be good. So about the anti-Mullerian hormone, what is it? It is a peptide which is secreted by whom? The granulosa cells of the primordial follicles. It is also secreted by the Sertoli cells of the fetal testis. This you should write in the exam. If you say it is only secreted by the follicles, then it's very bad. You should say it is also secreted by the Sertoli cells of the fetal testis. Only the fetal testis they are saying here. The textbook says that. Okay. Then what will it do? It will cause Mullerian duct regression during male sexual differentiation. Okay. What does AMH reflect? The number of growing follicles in the ovary. Okay, that is more for an adult female we are talking about. It also says how the oocyte will mature, right? How the oocytes will mature, how the follicular development, how a dominant follicle is recruited so that there is only one egg release, one oocyte released in the cycle. So monofollicular development. Okay, that's why I've shown only one here out of the basket. Fine. The estimation of serum AMH is independent of menstrual cycle. That means what? Any day of the cycle you check within those, any day, first day, day 28, whatever, the serum AMH levels will not alter because of the days of the, that is the menstrual cycle day, which day you are in. Because of that, it will not change. Okay. So, whatever they are trying to summarize here, they are saying that if AMH is high, what does it mean? Polycystic ovarian syndrome, if it is very high, it can be a tumor marker. Some optimal levels we have told you. If AMH is low, then it can also show a rise in FSH and E2. Okay, because the follicles have to be stimulated more. And if level is around 0.05 nanogram per deciliter, sorry, nanogram per milliliter, then it indicates menopause within 4 to 5 years. Okay. So according to age, they have not written here. They have not told you the levels as per age, correct? So it just talks about the quantity and not the quality of the follicles that we have told you. And now what was told for this patient, because she was having oligomenorrhea, they gave her this progestin, right? So that she takes progestin tablets now. And because the progestin level will be high, for some 5 to 7 days they will give, and then the progestin level suddenly drops when she stops taking the tablet, she should get her period, right? Then they called her on day 2 for her scan, right? Which they have not told her why they have called her. They've told come on day 2. Okay, that's what they will do. And then in the entire cycle, what will they do now? Scans to check for the follicles, how they are maturing and how they are follicle, what do you say that? Yeah, that only, right? And whether she will ovulate on day 14, right? Or these people have to give some drugs to make sure that she ovulates, and the couple has to try around this ovulation date, alternate days at least, for 10 days. That is 5 days before and 5 days after, we can say. 5 to 6 days before and 5 to 6 days after. Alternate day they have to try so that they can get pregnant, correct? Then what happens? If she, on the day 28, she should get her periods, and if she doesn't, then again they will do a urine pregnancy test to check whether she's pregnant. Else, again the cycle may continue where they'll have to give this progestin and make her get her periods, and again try the cycle. Okay. So this is how it is. There could be a lot of changes, whether the person wants pregnancy or the person wants regular periods. Okay, what exactly are they trying to achieve? So based on that, the treatment will be given. So anti-Mullerian hormone you have understood, hopefully. Bye bye.